Good afternoon, everyone. This is Miss Turner with Vidant Health and Vidant Medical Center in Greenville, North Carolina. I want to thank you all for being here with us this afternoon. We will go ahead and get started. I am joined by Helen Houston today. She's an occupational therapist in our Rehab Center, and we are going to get kicked off with our videos. But at first, I wanted to share with you a little bit of information about Vidant Health and Vidant Medical Center. We are located in Greenville, North Carolina, which is the eastern part of the state. We serve 29 counties, which is approximately 1/3 of the state. And basically, that's east of I-95 all the way out to the coast. Vidant Medical Center is in Greenville, North Carolina, and that is our flagship hospital. We are a level 1 trauma center with over 970 licensed beds, and we offer Vidant cancer care, Vidant heart and vascular care, our rehabilitation services, Vidant East Care, and Maynard Children's Hospital at Vidant Medical Center. We also have 8 additional hospitals throughout our region, as well as physician practices, home health, hospice, and wellness centers. We coordinate clinical education and residency programs with post-secondary educational institutions, and we also collaborate with secondary educational systems throughout Eastern region to offer programs to introduce students to healthcare pathways. In addition, we partner with Pitt County Schools and Duplin County Schools, offering a Health Sciences Academy program for high school students to gain exposure to healthcare and volunteer opportunities. So now we're ready to begin our videos of our Rehabilitation Center at Vidant Medical Center.
Center at Vidant Medical Center in Greenville, North Carolina. Since 1977, we have been helping people in Eastern North Carolina return to living happy, healthy, and productive lives. What sets us apart from other rehabilitation centers? 3 words: teamwork, commitment, and compassion. Our physicians and staff are dedicated to helping you achieve your personal goals, rediscover your independence, and reshape your future. Every staff member at the Rehabilitation Center is dedicated to helping you return to your home and your family as quickly as possible.
The nurses, all the caregivers were great. They took care of my needs. I had to have all of them because I couldn't eat. So I had the speech therapist, the occupational, the physical.
Our Rehabilitation Center is a 54-bed, inpatient, state-of-the-art facility that has been recently renovated with living areas that are both comfortable and attractive. Our rooms have been updated with electronic communication boards that provide you with up-to-the-minute information regarding your care. Additionally, several rooms have been equipped with overhead ceiling lifts as well as modern bathrooms to comfortably accommodate any patient. For more than 38 years, our Rehabilitation Center at the Vidant Medical Center has been a leader in quality care. Our physicians are board certified and possess specialized certification in spinal cord injury, traumatic brain injury, pediatrics, neurology, and pain management. In addition, our Rehabilitation Center has consistently achieved full accreditation by CARF and recognized for providing excellent care in several of these areas.
The CARF accreditation is very important to our Rehabilitation Center here. We have several CARF accreditations, which we've had for many years, that cover many of our specialty services, but they allow us to provide the highest quality care for our patients here at the Rehabilitation Center.
We are also the only rehabilitation center in the state that partner with a physical medicine and rehabilitation residency program at the Brody School of Medicine to provide you with the professional care you need.
The affiliation with ECU Physical Medicine and Rehabilitation program is important to us. We train several residents per year here at our program. We have the longest running physical medicine and rehab program in the state of North Carolina. And so it helps the relationship with Vidant and ECU for our physicians to work in both areas.
Our dedicated and experienced staff offer a wide range of skills to serve you. Many of our nurses and therapists hold advanced training and certification. Unlike other centers, Our Rehabilitation Center is also a full-service hospital. This means that we offer around-the-clock nursing care, physicians that will visit you at least once every day, and expert therapists patiently working with you a minimum of 3 hours daily.
When a patient leaves the acute care hospital, they can receive a variety of post-acute care, and the one that we provide is inpatient rehabilitation care at our facility. What that means is they receive 24/7 physician care, and they also receive much more intense therapies with our therapy services, and that equals about 3 hours of therapy a day, which is more than they'll receive anywhere else in the community.
To make sure that you receive the right care when you need it, we utilize an advanced electronic medical record system that allows your physicians to work cooperatively with all of the other physicians and clinical staff involved in your care.
Doctors come through, and they work on getting the problem that you got. They work on trying to get it fixed. Then the therapists take over and they make your system pick up and work.
We also offer a number of fully equipped treatment gyms to help you reach your goals in a quiet and comfortable setting. Our New Horizon Square and Therapeutic Courtyard are designed to reflect your home and community.
So we had a great experience, with nurses, doctors, therapists, the whole, and the system here, the tools that they've got in the gym to make things happen.
Another factor that makes us a unique facility is our specialized equipment used to treat spinal cord injury, brain injury, stroke, and amputations. These include the Zero-G harness system, which allow patients to work on balance and walking without the fear of falling, as well as the Locomat, a robotic treadmill designed to develop the skills of coordination and walking while enhancing a patient's endurance. In addition, we offer an 81,000-gallon heated pool where you can improve your strength and endurance under the guidance and supervision of a fully trained aquatic therapy staff. So, why should you choose the Rehabilitation Center at the Vidant Medical Center?
Rehabilitation Center at Vidant Medical Center has given me ability to cope with your disabilities and to get the most that you can from your body. And I believe that without it, I would probably still be in a wheelchair or worse.
These are the different therapies that I'm going to be covering today. That's my contact details. If you need to contact me in the future, my email and my telephone number to my office. So the areas that we're covering today is the similarities between OT, PT, recreational therapy, which we're calling TR, speech language pathology, and audiology. We're going to discuss some similarities. We're then going to discuss some differences and discuss how you can determine which profession best suits you. So the therapies in general are professions that deal with people. A lot of people go into these kind of therapies because they want to help people. And I would say that enjoying interacting with people is a very important part. If you're not interested in being around people or wanting to spend kind of quality time with them, these are not the careers for you. But if you do like people, all of these professions deal with people in a variety of different places. So a lot of the health professionals that we're discussing today are also across a variety of settings. We have therapies in the hospital, but we also have acute therapies, so in hospital rooms, inpatient rehab, which can be part of the hospital, or it can be a whole separate inpatient rehab. We have outpatient therapies. There are also private practices for most of these therapies. You may see many of them in the schools. You may see many of them in nursing homes. And they're also in things like home health and even businesses. So, you know, things like physical therapy would be in sports, like sports medicine. So a big variety of settings, but most of the therapies you're going to be able to go in all of those settings. So I always tell my students, if you're bored, it's your own fault. Because, you know, if you're sick of being in the hospital, go do it somewhere else. Go treat a different diagnosis or a different age group. And all of these therapies treat a variety of age groups. So with occupational therapy, we start in the NICU, which is the neonatal intensive care unit. So with the tiny little babies, premature babies that were born before their due date, and they, you know, we do positioning, we do splinting, we do a lot of family education, but they also are tested for the hearing. So an audiologist would test them. They also may have to deal with swallowing problems. So a speech pathologist would help them with that. Probably not too much recreational therapy except for maybe the parents. But, you know, starting from the tiny little babies all the way through school-age children, you know, young adults, older adults, and even to end-of-life care. All of these therapies can be seen in a variety of these settings. We also have a variety, you know, as I said, variety of age groups. And I would say the one thing that we all have in common is we're trying to make a partnership with the patient now, or with the client. So the client could be the patient. It could also be the caregivers, you know, the parents or the guardian or whoever's taking care of this person. And it's our job as therapists to evaluate where this person is, what their strengths are, what the areas are that they feel like they need to work on, what we feel like they need to work on, and make a partnership to help them achieve these goals. So we do an evaluation, we set what we call a treatment plan, which is how we're planning on helping them achieve those goals, and then we address the goals during therapy to help them meet those goals. There we go. So you can see at the top we have occupational therapy or occupational therapy assistants. I'm hearing quite a lot of feedback if people can mute themselves, please. So from like the community college level, there are occupational therapy assistant jobs, and that's true for physical therapy and for recreational therapy. They all have an assistant role to them. So there's occupational therapy, which is a master's level of schooling, or you can be an occupational therapy assistant, which is a diploma level, which, you know, is a whole lot less schooling, and you have different roles. So if you're looking at occupational therapy, the areas that we work with, we start with activities of daily living. So bathing, dressing, grooming, going to the bathroom, on and off the toilet, in and out of the shower. And then we advance to what we call instrumental activities of daily living. So those are like money management, medication management, cooking, yard work, going back to work, and then eventually driving. So that's what I'm doing right now, is I'm doing driver assessments. In fact, I have one today at 10. So, and I have one this afternoon. So people will come to me and I will assess their strengths and I'll assess their areas of impairment. And determine whether or not they have the skills to return to driving. So if they've had a stroke, or if they've had a spinal cord injury or an amputation, you know, see if they have the skills to get there. And if they don't, maybe encouraging them to go to speech therapy and work on their thinking, or go to physical therapy and work on strengthening themselves, or go to an audiologist and get their hearing optimized, or even go to an ophthalmologist and get their vision optimized. So I always say people don't often know what occupational therapy is, and I put a clock in the top left corner, because I say it helps people get back to doing whatever occupies their time. Okay, so occupational therapy is helping people get back to doing whatever occupies their time. So there's a big variety of things that we work on. And then physical therapy is probably the therapy that you're aware of the most. Again, there's physical therapy, which is now a doctorate program, or there's a physical therapy assistant program. And there's not one at Pitt, but there are at other community colleges. So you can see that physical therapists are working on exercise, they're working on strengthening, they're working on mobility. That's probably the biggest area. So walking, transferring in and out of a car, going up and down steps, you know, all the way to working on sports medicine and optimizing a baseball, you know, player's swing or how they're catching, or but they work with very similar populations. So orthopedics would be some, geriatrics would be your older population, pediatrics is your children. So you can see, you know, they work with a variety of populations. And then recreational therapy, and again, there's a recreational therapy assistant. They work what people do in their leisure time, what they do in their free time. So, you know, this is a very essential part, especially if you think of people that are retired. What they do in their free time is their whole lives. I mean, that's what you hope to retire for, is so that you can participate in things that you really enjoy doing. So this could be gardening, it could be fishing, it could be water skiing, it could be playing golf, it could be doing whatever you like to do in your free time. And recreational therapists assess the patient and then help them get back to doing what they like to do in their free time, maybe in a modified way, maybe in, you know, a slightly different way. You've seen like the Paralympics, or, you know, we have a group here called STAR, which is Support Team for Active Recreation. And they do a beach day. So people with disabilities go down to the beach, and they have those huge chairs with the big wheels so that people can get onto the beach, into the water. They do kayaking and fishing days. They have a bowling day. They do crafts. So a lot of fun things that they do with patients, helping them get back to enjoying what they do, you know, in their free time. And then speech language pathology, this is not at a community college level, but, you know, you could take a lot of the prerequisites to get into speech pathology at a community college level. So if you are thinking of going this way, I would definitely recommend looking into what prerequisites are needed. I would think things like biology, maybe chemistry, math, you know, those basic prerequisites. But speech pathologists work with primarily two big areas. The first one is speaking, so the formation of speech, and you can see them showing the larynx. So that's how someone produces sound. So if someone had a lisp, or if someone had a stutter, they could work with that. We have patients in the hospital that have had a stroke or a brain injury or a brain tumor, and they have a really hard time because of the area of the brain that's been affected. They can't remember how to speak, or they know what they want to say, but they can't get it out. So speech pathologists would do exercises and would teach them maybe some compensatory strategies, so some different ways to do things, but they would help them to get back to communicating. So that's the one area. And then the other area that they deal with a lot, speech pathologists tend to deal with the head and neck. So the other area is swallowing. And a lot of the time, again, babies have a hard time with swallowing. So we have a feeding clinic at the hospital, and occupational therapists and speech pathologists work together to teach parents how to help the child to swallow, to teach if they're feeding disorders. But they also work with adults. So someone that's had some kind of like a back surgery where they had to go in through the front, sometimes those nerves get damaged, and they have to learn how to swallow again. And this is an important thing. If you can't swallow, you can't feed yourself, you can't eat. That's a big joy in life for a lot of people, is to be able to eat. So being able to teach them how to go back to doing this area that's very enjoyable is another area that speech pathology work with. They also work with cognition, so thinking skills. So occupational therapy and speech pathology both address this. With speech pathology, they do more of the thinking skills, like pen and paper, that kind of thing, whereas in occupational therapy, it's more of your functional thinking skills, like if you're cooking, did you remember to turn off the stove? Can you follow a recipe? Those kind of thinking skills. And then we have audiology, and again, this is not an area that you can get an audiology degree at a community college, but you can get the prerequisites to go into audiology. So audiologists work mainly with the ear, and they're working with, as people get older, maybe their hearing gets a little more difficult. So hearing aids. You can see the little girl on the bottom has a cochlear implant. So that's an implant, you may have seen children with it, that helps them to optimize their hearing. If they have hearing loss, it helps them to hear as best as they can. They also will check ears, they'll work with balance, because your ears help you with balance. So if people are having vertigo or dizziness, a lot of audiologists work with that. So huge, a wonderful degree. My best friend in South Africa is an audiologist, and very, very needed. If you think of going through life without being able to listen to music or hear your parents or best friend being able to talk to you, you want that to be as good as it can be so that you can interact with your environment. So how to decide which profession is best for you? You can see a variety of the professions here, and you need to know yourself first. You need to know what you like and don't like. A lot of the occupational therapy and definitely some physical therapy, in the hospital, you're dealing with people, so there are some body fluids involved. And you have to decide your tolerance for that. Now you do build up a tolerance. After a while, you can handle things that you probably couldn't handle at 15 or 16. But, if you can't stand the smell of a hospital, this is not the place for you. Those basic things are things for you to know and for you to decide. So I would say the more that you can observe different professions doing different things and see for yourself the way it suits.
Okay, I think we're now ready for our chat session, our Q&A. So if you guys have questions, feel free to go ahead and put those in the chat. And then our moderator will read those out for us. And either Helen or I will be able to answer those questions. But I have a feeling Helen will be the one answering those for us. So again, go ahead and put your questions in the chat and we'll start answering those for you.
Well, we already have one question that came in while the video was going. Isabel asked, if you want to be an occupational therapist and work with children that have autism, etc., how would you get to that point?
So that's a good question. What I would recommend is that before you even get to school, get into graduate school or whatever, that you try to maybe volunteer to work as a sitter or as a assistant with some of these kids. But it's definitely a pretty normal setting. It's not unusual. When you choose your fieldwork settings, so you typically will do 2 1-week fieldworks, and then you'll do 2 12-week fieldworks. And when you choose those, you would request to be with pediatrics and specifically with children that have autism.
Okay, thank you. We have another question. How can someone find out about the volunteer opportunities with you all in these fields?
So we usually take volunteers at the hospital, but currently, due to COVID restrictions, we're kind of limited on who is allowed to come into the hospital, just to decrease exposure for our patients and our staff. But there is a volunteer organization through Vidant Medical Center, and at most hospitals, there would be a volunteer, section. So I would apply there, and there's usually a few things you have to do, background check, maybe possibly immunization screen, that kind of thing. And then once that's been done, they should be able to set you up with some volunteer hours. And we at Vidant typically don't have people volunteer with children, just because we have a limited number of therapists that work with children, and we're having to give priority to people that are doing their internship, to become professionals. So we usually do most of our volunteering and shadowing with people that they typically are adults, but it's a good idea to see all these different careers in practice if possible. And that can be at the hospital, it could be at a nursing home, the schools obviously would have that age group of child, private practice, home health. There are a lot of different settings that all of these different kind of careers could work in.
And is there an age requirement for these volunteer opportunities that you know of?
I want to say they have to be 16.
Okay, awesome. Thank you. We have another question from Malaysia. She asked, what is the hardest part of your job?
So I would say that kind of depends on the setting that you're working with. Working with children, the hardest part was working with children that have been abused. And the children were fine, but having to work with the parents or the caregivers that were the ones who abused the children, and be professional with them, that was really difficult. What I'm doing right now is doing driver evaluations. So the hardest part of that is having to tell people that they are not medically fit to drive.
so that they have to find alternative ways to get around. So, I think we all go into these professions because we love people, but sometimes we do have to give them bad news, or they're going through really hard times. So that's an honor to be able to go through those times with them, but it can definitely be challenging. And, it's hard not to kind of take it home emotionally.
Okay, thank you for that. What is the salary range for these types of jobs? So starting in like the entry level and then working your way up, what can you expect salary wise?
So this would depend on whether you were coming in at the assistant level. So the physical therapy and occupational therapy have assistant levels, and so do recreational therapy. So those are typically a 2-year diploma from a community college. I'd say that they typically would start around $25,000 a year. And then if you are doing, going through a master's or a doctorate, which obviously needs more schooling, you're looking probably at about $45,000 a year entry level. But most people don't go into these careers because they are only searching money. I know you have to pay the bills, but you would not go into such a challenging career if that's what you were looking for. There are definitely easier ways to earn money, but as far as meaningfulness and as far as feeling like you're making a difference and really helping people, you can't beat them. They're wonderful, absolutely wonderful. The rehab services are a very precious thing. I've been coming to work 27 years, and I love coming to work every day.
That is incredible. You definitely have to be a special type of person to have this sort of position.
Yeah, it's, all kinds of jobs are not for everyone. I don't think I could sit behind a desk all day, but there's some people who love that. So I like to be up and moving around, and I like challenge, and I like days to be different. So if you're looking for that kind of thing, these kind of rehab services jobs are good.
We have a question from Hannah. She asks, how many years do you have to go to school? And I know you just said that you can come in as an assistant and do a 2-year degree, but could you just clarify again what sort of jobs you would you'd be able to get with each level of degree?
Sure. So with the physical therapy, occupational therapy, and recreational therapy assistant jobs, as I said, it's about 2 years at a community college. And assistants on the whole can work with patients really throughout the continuum. The biggest difference is that they don't do the evaluations and they don't set the care plan. So they don't set what the treatments are going to be. In order to be in those roles in OT, PT, rec therapy, speech therapy, and audiology, you would need to have at least a master's. And that's usually 4 years of undergrad plus 2 or 3 years of graduate school. Most of the PT schools are now going to doctorate. In fact, I think all of them are doctoral level, so you'd have to do an extra year or 2 after that. And some of the OT schools are doctoral, some of them are just master's levels. So, and rec therapy, I believe, is still an undergrad, so just 4 years. Speech therapy and audiology, you'd have to have a master's, so at least 6 years.
Okay, thank you. We have a question from Summer. She asked, what does a normal day look like for a physical therapist or physical therapist assistant?
Okay, so again, it would kind of depend on the setting. So it depends on where you work. But I'll give you, for example, in the rehab at the hospital. So you'd come in and you would do some chart reviews. So you look at the medical chart and see what's been going on, like what happened the night before. Is the patient medically stable? Have there been any problems overnight? And then you would be scheduled to work with patients, usually for the whole morning. So either one patient, sometimes they'll do a group, or sometimes they'll do kind of overlapping patients. But typically, if you started, let's say, at 8 o'clock in the morning, you'd have patients from 8 to 12, either on the half an hour or on the hour. You'd then have about a half an hour lunch break, half an hour for documentation, and then you would see patients again from 1 to 3 or 4, pretty much back to back, and then you would do documentation after that. So I would say that the majority of us are working with patients for the majority of the day. Most of our productivity, it depends where you are, but I'd say it's about 80%. So 80% of your day, you're probably going to be working with patients, which is great because that's what we want to do.
Awesome. If you guys have any more questions, feel free to put them down in the chat. Oh, actually, I see some more. I just had to scroll. I'm sorry. Isabel asked, where could I find an occupational therapist volunteer center or a place I could shadow? Is there like a site or a resource that we could put in the chat?
So I don't know about just an overall site. I don't know exactly where each of the students are, but I would start with medical places around where you are. So I would kind of Google occupational therapy or physical therapy, whatever you're looking for, within your area. So a lot of private practices, like a clinic, may do volunteers. I know we have nursing homes around here, for example, McGregor Downs, which is a skilled nursing facility. So at a skilled nursing facility, they have to receive therapies for at least the first 3 weeks. So depending on what the person needed, they would have at least occupational and physical therapy, and then maybe speech or, recreational therapy or audiology, depending on what they needed. And I know that many of the nursing homes have a pretty strong volunteer program. So you would apply, call the nursing home and you'd say, I'd like to volunteer here. I'd like to learn more about these kind of, rehab services kind of careers. When can I apply? How do I apply? So it's more on an individual place basis than an overall site, I'm afraid.
Okay, our next question is, what kind of training do you have to complete in order to be a physical therapist? And I'm going to kind of pair it with another question, which is there a lot of continuing education required for each of the jobs? So what sort of training or continued training do you have for these jobs?
Okay, so as I've said, kind of the schooling I've told you about. So you'll usually do, for example, physical therapy, your 4 years of undergrad, and there will be some prerequisites that you'll need to complete in order to apply to the graduate school. So, you need to look on each school and see what their prerequisites are. But then you'll do kind of the theoretical part of each career in the beginning when you get into the program. And then there'll be a lot of kind of field work time that you spend with the patient in various different settings. Where I graduated, we had to have 1,200 patient contact hours. So a lot of time spending, with the patient, with another therapist, kind of teaching you the hands-on part of the job, which is very important. And then once you graduate, we do have to have, all of the careers have to have ongoing education. For occupational therapy, we have to have 15 hours every year of continuing education. And that's usually, you would choose an area that you're needing to improve on, or you want to specialize in, or you'd like to receive a certification, something like that. But there are conferences that you could go to. There are quite a lot of websites now that you could do online learning. So, that's a very important part of any of these rehab services. You want to keep up with the latest research. You want to know, as new technology comes out, how to use it so that you're giving your patients kind of cutting edge intervention as much as possible. So that continuing education is very important.
Okay. Hannah asked, do you work with cancer patients?
So that answer is yes. I work in a variety of settings. So I work in acute, which is when patients first come into the hospital, and we have a cancer tower. So a tower where most of the patients that are in that area have cancer. They are usually going through either chemotherapy or radiation therapy at the time. But it's very important that they continue to work with therapies to keep them strong, to help them able to do as much as they can do so that they can go home and, operate at their most independent level. And then from that level, people will be discharged either home if they're ready, or to rehab, or to maybe a skilled nursing facility if they're not able to tolerate the 3 hours of rehab. So any of those settings, you're going to be working with people that have cancer. And then once they go home, you would either work with them as a home health therapist, or they may come back and receive outpatient therapy. So pretty much anywhere in the continuum, you're going to work with people that have cancer of all ages. So, for example, I really thought that I'd be working with doing the driving evaluations. I thought that I would be doing mostly kind of 80 and 90-year-old people. But I'd say my average age is about 50. So I worked with a guy this morning who's 48, who has had a brain tumor and is trying to go back to work. He drives trains. He drives locomotives. So, you wouldn't think, I wouldn't have thought that I would necessarily be working with cancer patients, but, there's so many different kinds of cancer and so many different, the treatments are so much better. So there just is a huge variety of where people could be, either with active cancer or that they've treated it and, hopefully it's in remission.
Okay, thank you for that.
Yeah.
What is an average number of patients you see in a day?
Again, that depends on where you are. I would say probably 7 to 8 would be about, like in acute, in inpatient rehab, in outpatient. So, if you're working an 8-hour day, I'd say the majority of that would be with patients. And it would depend on, usually you would spend about an hour with each one. There are some outpatient clinics and that kind of thing where I know that they'll start one patient, put them up on modalities or something, and then they'll start another patient. So they kind of overlap. So they may have more than 8 patients a day. And then the more specialized clinics, for example, what I do the driving, I really only have 2 patients a day, but the evaluation and the time that I spend with them is much longer. So I spend 3 to 4 hours with one in the morning and then 3 to 4 hours with one in the afternoon. So still the same amount of time with patient care, but fewer patients. So it just depends where you are.
Okay. If there's any more questions, feel free to put them in the chat. While we wait on a couple more, I had a quick question. So, what qualities do you look for in a person going into this field beyond having, the education and the experience? What qualities are you looking for them?
That's a very good question. So I would say that, it's important that the person has pretty good interpersonal interactions, that they get on with people, that they like people, and that they are comfortable around people of usually all different ages. What we're often looking for is someone who can think very independently and problem solve. So whenever you have a patient, whatever age or whatever, you kind of evaluate the patient in the beginning and you're trying to find out what are their strengths and what are their kind of barriers to being independent. So what are the things that we need to work on with them to try and help them get back to doing whatever's important to them. So, there's no kind of cookie cutter approach that every person with a stroke, you do exactly the same thing. There's a lot of kind of thinking and problem solving and trying to dig down to find out exactly what the issues are and then make a treatment plan based on what that is. So that kind of problem solving and clinical thinking is very important. You need someone who's able to be pretty independent, working, by themselves. A lot of these jobs have quite a lot of a physical part to them. So when patients are weak, having to help them get out of bed or help them go to the bathroom or get into a wheelchair. So there's quite a lot of hands-on lifting or definitely assisting. So I'd say probably the least hands-on would be your speech language pathology and your audiology. That's not to say they don't have any, but they would probably be the most kind of hands-off, whereas OT, PT, and recreational therapy, you're very much hands-on and helping the patients when they can't physically do something. So there's definitely, there's the other thing that I would say is that you need to be able to generalize information. So kind of learning all the theories and all that kind of thing, but then applying it to that specific patient. So, academically, it's important that you learn all that you need to learn, but then that learning how to apply it to this person who's right in front of me, that level of decision making is challenging at times. And, emotionally, it can be very difficult. It can be very rewarding, but it can also be challenging when people are going through a really hard time. So you need to have someone who's pretty strong emotionally, I would say, pretty mature. Does that answer your question?
Yeah, it definitely does. Thank you so much for that.
Yeah.
Well, if we don't have any other questions, if you want to go ahead and say any closing remarks, we'll go ahead and wrap up a couple minutes early.
Okay. Well, I really appreciate everyone's time and attention. I'm sorry I couldn't directly see you. It's just technology is always a challenge, but I would encourage you to, whatever profession you're looking at, try and learn as much as you can about it. Try and research as much as you can, but see it in person as much as possible. This is a decision that you're making for the rest of your life, probably. It's a big investment financially. It's a big investment time and energy and just amount of your life that you're putting into this. So you want to make sure that from the beginning you're hopefully making the right choice for yourself. I think it's very important to know yourself. So the more you can kind of learn about yourself as far as what you do like and what you don't like in different careers is important. Just trying to get a job, doing anything to start off with, will help you learn a lot about yourself. So whether that's flipping burgers or volunteering or, helping out in a garden. I mean, it's just, I have two girls that are just in their early 20s, and with both of them, I taught them as much as I could, but just having a job that they have to go to every day, that they have to listen to a boss, they have to show up on time, they have to be professional, and they have to be pleasant to the other people, whether they like it or not, were very important lessons. So I would say just getting a job and learning about yourself so that you can make the best decision that you can, and then learn as much as you can about the career. And if you have those two things in place, you can pretty much do anything. So that would be my recommendation, is just explore yourself and explore different jobs. Just, you never know what you like. Most occupational therapists that come in as students tell me, I want to work with children. I want to work with children. But that's because that's all they've seen. So when they start to work with older people or adults or different settings, they fall in love with working with geriatrics, or they fall in love with working with teens or whatever. But they wouldn't have known that if they hadn't tried a variety of different things. So I would highly recommend just keep your minds open, keep different options open. It's too early to make a definite decision. Just explore as much as you can.
Awesome. I just want to chime in and thank everyone for participating this afternoon. And if you come up with any questions later, you are able to send those in and they will be forwarded to us, and we'll be glad to answer those for you. So again, thanks so much to everyone who has been able to participate this afternoon, and we wish you all well.
Thank you very much. Bye.
Thank you guys. Bye.